Have you had any experience where, whether with antibiotics or with herbal antimicrobials, where using them led to like a yeast overgrowth that caused an exacerbation? I get a lot of people that have come from kind of the main medicine world, and they were put on antibiotics, and then they started having severe reactions to the antibiotics, and then we test them and they have major yeast problem now. Is that something you've seen as well with antibiotics or even with antimicrobials? Because that's the other thing. A lot of people just go buy antimicrobials online, and then they take a heavy dose, and then they may have like super symptoms, right? What they call detox or Herxheimer response type symptoms. But have you seen that, that those cause yeast overgrowth?
Yeah, and I think that I've seen it with both. But I think the reason is sometimes different. So when you're using antibiotics, oftentimes, you're getting dysbiosis from the antibiotic. It's destroying all the good and bad bacteria, and then that fosters the growth of the yeast. Sometimes what's happening with the natural herbs, and most of the time the herbs that we're using are doing double and triple duty. So if I'm using something to go after, let's say, Babesia, which is like a Lyme co-infection, oftentimes the components of that are also antifungals. So the only time that I see yeast popping out is when we get what's called the whack-a-mole effect, where you start to go after a particular infection, and sometimes the infection is bound to another infection, and that infection starts to release. So an example of this, if we were to use like the yeast case, would be, if we're talking about Babesia, oftentimes these people are like the hottest people in the room. They run hot. Oftentimes they've got spontaneous sweating, which is not to be confused with menopausal symptoms. They usually have awful sleep. They'll have anxiety to the point of panic attacks, depression to the point of suicidal thoughts, and they'll have like shortness of breath. And so let's say we're going after Babesia, and then all of a sudden they start to get an itchy anus. So itchy anus sometimes is going to be yeast, it could be mold, or it could be parasites. Or maybe they've got itchy ears. Itchy anus and itchy ears oftentimes can be one of those three things. So we'll have to see what other symptoms are popping up too. But I call that a whack-a-mole. And so I don't think necessarily that they're causing the same dysbiosis that the antibiotics are causing, but I do think that they are allowing other infections to kind of come to the forefront. And so oftentimes then we have to address those with maybe a different antimicrobial and kind of keep that in check, and then come back to ramping up on our dose of, whatever we're using for Babesia in this case.
Okay. So you go through the process. You use nutrients, you use binders, you use microbials or antimicrobials, rather, herbals, as opposed to antibiotics. And what are your favorite binders? Are you using charcoal, zeolite? What do you find to be helpful?
Yep, generally a combination of those charcoals, the French clays, zeolite, and the different mycotoxins that people have oftentimes require different binders to be used, humic and fulvic acids. So, depending on the person, depending on the mycotoxins they have, and depending on how they can navigate the supplements that they need to take, are going to determine which binder I'm going to use. Because some of the humic and fulvic acids, you can actually, because their particle size is small enough, you can actually take them with other supplements, which makes it a lot easier to take, as opposed to some of these other ones that you have to take about an hour or an hour and a half away from everything, all food and supplements. So sometimes that'll play into what I'm doing.
Do you do you ever do any kind of testing on diet? So like you're doing supplementation to help through these processes, but how do you manipulate a person's diet so that it best supports them? Is there an anti-inflammatory protocol that you use, or do you do testing for that as well, where you're testing for food sensitivity? What does that look like?
So I'm pretty simple when it comes to diet, because a lot of times when people come to see me, they've worked on their diet a lot. and it's kind of the last thing that they want to work on. And so I tell them I want them to be gluten-free, dairy-free, sugar-free, alcohol-free, and preservative, artificial stuff free. And then mainly, eat meat and veggies, if you are eating meat. So it's more of like a paleo diet sort of thing. And part of that, and I don't do any food sensitivity testing, because I find that that helps most people. And there are some nuances to, like, I could do food sensitivity testing, and then we could remove maybe one or two foods, and maybe that'll help them. But it seems like, in terms of the time and the cost and the focusing on the step 2 stuff, which is replacing the deficiencies and modifying the diet and stuff like that, distracts from getting to step 4. So we want to make sure that we are really focused on removing the heavy metals, the chemicals, the molds, the infections, and the trauma, because those really are the biggest needle movers. So there's no doubt that a food allergy test can potentially help folks, but I just don't find it's the biggest bang for the buck. And when we're dealing with, potentially 38 different causes, I try to keep it as simple as possible.
What are you seeing as a time frame for recovery? So somebody comes in with long COVID, 6 months, 12 months. What does that look like on the tail end?
Yeah, so it really depends on how long they've been sick, but all of our programs are now a minimum of 12 months. They're actually all 12 months. So, and I tell people, you're going to spend at least 12 months with me. Now, the goal is for you to be 80 to 100% better at 12 months. And there are people who are better at 12 months, but a lot of people aren't. And it's really just the reality of, how many causes do you have? How severe are those causes? How are you going to react to treatment? And how long is it going to take for those causes to get out of your body? Because when you're looking at heavy metals, chemicals, molds, infections, and trauma, each one of those things on its own will take 6 to 12 months. Now, we try to do them all at the same time, but you have to realize that this is kind of like getting a master's degree in your health. Like, you invest the time, energy, and money now, and then you've actually decreased a number of the causes that later in life will cause heart attacks, heart disease, strokes, Alzheimer's, and cancer, right? These are all those same causes that we're talking about. So it's kind of like you invest your time, energy, and money now in order to be able to take care of your symptoms so that you can feel better and you can function, you can enjoy your life. And the added bonus is that you're going to decrease your risk of having a number of these things, and potentially you can live longer and stronger.
Yeah, it makes sense. So what, I'm going to back up just a little bit. So you said early on in this conversation that you had chronic fatigue, and I'd love to just hear you talk, because with your training, my training is different than yours. Your medical training. Do you have a history where you had fatigue and you went through kind of traditional medical role model, or the medical model, right, of assessment and treatment? And did you hit it again? I don't want to put words in your mouth, but did you go through that model where you went through it and it failed you, and then you tried to get better, and so you had to seek out new knowledge and new information in order to make yourself better? Is that because so many doctors that I meet have that as a background for their history when they end up in the kind of the what we would call the natural or alternative realm? It's because they struggled with their own problem. Can you share a little bit about your background and story there?
Yeah, well, and what's interesting is that I was failed by functional medicine, which is really interesting. So I came out of residency in 2007, and I did my first functional medicine training in September of 2007. I was already when I was in residency, in family medicine residency program, I was already practicing acupuncture. I had done the Helms medical acupuncture for physicians through UCLA. I was practicing integrative medicine. I was already board certified in holistic medicine through the American Board of Integrative and Holistic Medicine. So I was already doing all those things. And so I came out, I'm practicing functional medicine. And so part of it was prioritizing myself and taking better care of myself. And so I was fine up until about like 2010. So 2010 to 2015 really were my years when I had chronic fatigue. And so I had to start prioritizing myself. I also didn't know I'd gotten most of the people that I had seen in my practice a lot better by focusing on step two, which was replacing the deficiencies, managing their lifestyle habits and improving those, optimizing their thyroid, you know, decreasing their heart risk by, working on cholesterol and their fat balances and all that sort of stuff. So I got a lot of people better by doing that. Now, there was a segment of people that were really hard, and I knew that I didn't know enough in order to help those people. And those were people that I learned later had heavy metals, chemicals, molds, infections, and trauma, right? So the thing I focus on now were the things that I didn't know then that I had to learn because I had those things. And so then I went on a journey because I was sleeping underneath my desk in this very successful clinic during lunch because I felt like crap, right? And so I was pushing through every day. I was coming home and my daughter I had a young daughter at that time, and she would say, "Daddy, play with me." And I couldn't. I was like on the couch. My wife was actually just coming out of fatigue that she had had from 2004 to 2007. And she needed me to do the dishes, and I couldn't even do the dishes. You know what I mean? So that was a really challenging time for me emotionally, in addition to physically. And so I had to go through a process of figuring out what all these causes were. And I went to environmental medicine, which is a lot of people aren't, not a lot of people know about, but that's really who at that time was talking more about the heavy metals, the chemicals, the molds, the infections, and they weren't even talking about the trauma. Trauma was more recently. So I started going after those things, and I found that I was getting better and better and better, started incorporating them into my practice. And then eventually that became my whole focus, was helping people who were left behind, kind of like I was, because unfortunately, I know you've kind of gone in this direction in part because of the struggles that you've also had. But there's a lot of functional medicine docs out there, natural docs, integrative docs, who help a lot of people. 90% of the people that walk through the door, they can help significantly, but there's that other 10% that they can't. And those are the people that come to us because they have these other causes that are more challenging.